Good evening, everybody, and welcome back to MIMS Learning Live for the final part of the evening, where I'm going to hand over now to Dr. Anthony Cunliffe, who is a GP down in Tooting, but also the lead medical advisor for Macmillan's Cancer Support. And he's going to be talking to us about health inequalities and cancer for the next 35 minutes. As before, if you have any questions, please trickle them through and pop them into the questions box at the bottom of the broadcaster screen. And I'll do my very best to get to all of the questions, if possible, in the final 10 minutes. So without further ado, I'll hand you over to Dr. Cunliffe. Thank you very much.
Thank you, Pip. And thank you for everyone that's attending this evening, especially sticking out to this late hour after probably for a lot of you what was a long day in practice. So appreciate that you're here, but hopefully you're stuck on to hear what is a really important subject in how we can address health inequalities with a specific focus on cancer. And so I'm going to run through my slides, and I will say that a lot of my slides are focused on health inequalities in general and how we can address health inequalities, because even though we've got a specific focus on cancer tonight, a lot of the issues that face a lot of our underrepresented populations are issues that impact on all the health issues and the challenges in engaging with the healthcare system. So the first half, at least, of my presentation is going to be focused on health inequalities in general and kind of the drivers that lead to those health inequalities, because I think in primary care, if we understand those drivers that lead to the issues that our underserved populations are facing, that's how we can begin to address and improve their experience of care. So I'll move on now. So as primary care teams, obviously we all look after a pretty varied demographic, and for some of us in some parts of the country, we will have a very varied demographic, and we'll all have populations of underrepresented groups in our catchment areas. And obviously there are a myriad of different underrepresented groups, and as primary care professionals, really understanding our demographic in detail can really help us address the issues that some of these groups are facing.